As you all know, I'm in the business of predicting, and I probably don't have to tell you that there is a bad allergy season predicted to continue for the second half of it. The allergist, Dr. Robert Owen, is here, and I'm assuming right now your office is a pretty popular place, especially the first half because the pollen count was just off the charts back in March and early April.
Yes, it certainly was. It's been the highest we've seen in a long time.
All right. The recent cold snap, especially Easter weekend, helped bring it down a little bit?
A lot. People have been very much relieved for about a week, but crises are on the way.
All right. So somebody says, all right, I'm having an issue, or I've just moved to Tennessee and I didn't have this problem when I was back home. What are some of the things that you can do? There are actually 3 steps. Let's talk about one that's kind of a short-term step.
Well, the short-term step, of course, would be to take some medication, go over the counter, and find some antihistamines that wouldn't make you sleep either are out there now, and try those. And there are nasal sprays over the counter, not the type that decongest you, but the type are done for allergy. And those are helpful. But generally, you can't avoid these things. That would be the other step. You can avoid them somewhat by staying indoors in the mornings and air conditioning, because pollen count's higher then. But generally, you're going to suffer if people can't just hibernate. So basically, it's a situation where you're going to live with this and treat the symptoms, or try to go for some type of improvement in your general response. Build your tolerance to these pollens that are bothering you so much, and that's where we come in. Okay. Now, there's a term that may have been out there in your world for a while that I hadn't heard it before, immunotherapy. Tell me about that. Well, immunotherapy to most people means allergy shots, and they certainly do work, and I gave them for many years. However, I've switched to sublingual drops, which are the same substances given in shots, used under the tongue. And we use those 2 ways. We give the drops on a regular basis, daily, which suppresses the reaction and builds your tolerance to even the foods you're allergic to, including the pollens. So if somebody actually knows that, hey, allergy season's coming up, it's going to be bad for me, you're telling me that they should come maybe see you in February? Exactly, or maybe a little earlier. Okay. Right now, I would say we would look for ragweed patients who have a lot of trouble in the fall, and we start them on treatment now, and then we give them a special treatment of advanced drops for about 6 to 8 weeks before and during the ragweed season. Who are good candidates for the drops? People who have severe allergies and have not tolerated injections previously. Young children under the age of 3 or 4 can't get shots very easily. Some people don't like needles, both children and adults. There are people that travel constantly. There are entertainment individuals that are on the road all the time. They can't take injections. So there's a lot of people that have not even thought about this before who can consider it now. All right, if you will quickly tell me, how effective have they been? They've been very, very effective. All the studies at this time that are coming out have been very effective. Duke University is using our technique to treat peanut allergy now, and they have a study going which we'll know more about, which is really, really, really important with the children with peanut problems, because the school's a lot of problems. Well, once you know more about that, please let us know. Thank you very much. Thank you for being with us today. You can find Dr. Robert Owen at Allergy Care of Cool Springs. We'll also link our website to theirs at coolallergy.com.